This podcast is for informational and educational purposes only. It is not medical care or advice. Clinicians should rely on their own medical judgments when advising their patients. Patients in need of medical care should consult their personal care provider. Welcome to That's Pediatrics, where we sit down with physicians, scientists, and experts to discuss the latest discoveries and innovations in pediatric healthcare.
I'm Allie Williams, one of the pediatric hospitalists here at UPMC Children's Hospital of Pittsburgh, and today, while I am without my co-host, Dr. Agnihotri today, I am so excited to be talking with Dr. Ken Nischal, who wears multiple hats. He not only is the chief of the Division of Pediatric Ophthalmology and Strabismus, as well as a professor of ophthalmology, but he is also the medical director for digital health, and that, I believe, is the hat that we're going to be talking about today. Thank you for being here, Dr. Nischal. I am so excited to be talking to you as the medical director for digital health.
Thank you so much for inviting me. I really appreciate the opportunity to come and talk to everybody about what we're doing at Children's Hospital with the digital footprint and the digital space.
I feel like digital health is newer these days, so can you kind of talk to us about how digital health, or even that term, evolved?
Sure. As we all know, we went through this terrible pandemic and lockdown, and we suddenly realized that there were patients who needed to be seen and we couldn't see them. Mm-hmm. So we pivoted at Children's from doing 500 telemedicine visits in January 2020, to by the end of May, something like 19,500.
Oh my goodness.
And so that was a tremendous amount of effort, both by the IT team, by the doctors themselves, and we were able to do this because of the public health emergency. This was a declaration that said you can deliver care, you didn't have to be in the same state, because we had patients who used to drive into Pennsylvania from other states, and now they couldn't. Right. So we had to get rid of that barrier. We were able to see patients at home, which we couldn't do before. The public health emergency is ended in May 2023. But thankfully, some of the changes we saw then are continuing and allowing us to deliver healthcare. Now, there is the actual visit, right? The telemedicine visit, and you need to have good Wi-Fi. Cellular data is not so good in doing a face-to-face, so you need good Wi-Fi. And then what you need to do is to make sure that you've booked your appointment. And what we're doing at Children's is we're offering parents the opportunity to book online. They can book online for a digital appointment in the comfort of their own home. So the whole thing about telemedicine is that it's part of digital medicine, digital health, which encompasses not only the actual visit and the exchange of information, but it also encompasses parent education, patient education, and the education of the providers, so that we can together deliver a much better service. And I can give you a couple of examples of that. Would that be okay?
Yeah. Oh my gosh. I would love to know more, because whenever I think about digital health, I think about a virtual clinic appointment, but it sounds like there's more than that.
There is. So imagine that you have a patient coming in for a procedure or even just a test. Some of the time we spend is explaining to parents what we're doing, and that's face-to-face time. If we could utilize that time through a digital appointment, so that an APP, a nurse practitioner, could explain to them what the test entailed, why we were doing it, you as the provider have saved that time in clinic and perhaps allowed an open slot for a patient who's a new patient who perhaps previously may have had to wait several weeks, but now because we've freed that time up, you're able to see a new patient sooner. More importantly, what we found is that parents love the digital exchange because they get information sent to them digitally. They understand what's going to happen. Somebody explains it to them. Now they come into the hospital and they're not strangers. They know exactly where they're going, why they're going, and what they want. And the error rate of getting the wrong test is dropped. So all of this sort of, if you like, bolsters what we were already doing. Now imagine a situation where you have a family who they find it difficult to come to the hospital. But they find it easy to get somewhere that's relatively close and is a UPMC facility. Well, we can do a telemedicine in that UPMC facility with testing that can be done on that site so that the provider has the information they would have had even if they were there here in the main Lawrenceville site. Mm-hmm. So now what we've done is we've expanded our footprint and allowed parents to choose what's convenient so they don't miss their appointments.
And it sounds like you've gotten a lot of positive feedback from this too, because it reduces the fear for families and they have all of the knowledge before they come in as opposed to coming in kind of blindsided.
Totally. And the thing is, I wouldn't say that it's been easy for providers because we've had to change our mindset, right?
Yeah.
We were brought up to see patients. This is how we were supposed to do it. They come in, we have a clinic the whole day. But now we're finding that providers are beginning to pivot. So if they know that they've got 3 empty slots because parents rang and said we're cancelling, they're now saying, well, maybe I can put in a couple of telemedicine visits because I was supposed to give so-and-so the results of their MRI scan, and I can do that face-to-face, tell them what's going on and what the next step is. So we are finding that providers are going, well, actually, I can save time for the parent and myself and just get things going. It's becoming a little bit easier. Still a lot of steps to take, but becoming easier. Imagine a situation where, and we are there right now actually, where we can have an application, a software application that pulls in all the data for one of our patients. Let's say a patient who's diabetic. Mm-hmm. And the patient who's diabetic got an app to take home that they play with in a pictorial way that tells us what they're eating every day. So it has candies and meat and vegetables, and you find that the candies are being hit on more often, and then they get a blood test done, or they're getting constant monitoring that can happen now. This software that we have called Zelf, we already have it at UPMC on the Epic side. It can draw all of that data and send a report to the provider before they see the patient and say, by the way, this is what's going on. These are the tests we recommend they get as they come into the clinic. Patient goes and gets the tests, but by the time they see you, you've got all the data. So now, instead of having to go back and forth, the patient's visit becomes more coordinated and more concentrated. So you're doing what you're good at, advising and planning and treating.
As opposed to taking all the time to ask the questions where parents feel like or patients feel like they've answered the same question over and over again.
Absolutely. Now imagine, let's take digital health to another plane. What if we have a wayfinding app? Imagine you've got an appointment at 10 o'clock in the morning and you live in Butler, PA, mm-hmm. and the wayfinding app alarms and says you should be leaving right now because the traffic conditions are such that you're going to miss your appointment if you don't leave in the next 15 minutes. Patient leaves, gets here, and gets told, doctor's running a little late. On the way to the clinic, these are all the places where you can sit and have a cup of coffee or a bite to eat if your child is hungry. They come in and they're told, because of the tests we did last time, you need to get these tests. Away you go, and the wayfinding app tells them, just like they do on Google Maps, this is where you walk, go and get the test done, and then come back.
I feel like that would make things easier.
Right. So we are actually in negotiations at the moment about getting a wayfinding app like that. And the wonderful thing is, Children's Hospital is the only hospital in the UPMC system that already has the routers in all the spaces, including the car parking. Imagine if you were getting close to the hospital and it says, don't go to that parking space because it's full. You need to go to the other one. You're changing the whole journey. Now, that's a convenience issue. But in 2023, the easier we make it for our parents, the more likely they're to turn up, the more likely the children are going to experience a good journey, the more likely we're going to get a good outcome. We're also working with a company where a child can make its own avatar, and then it can place that avatar in the surroundings that it's in. So imagine for the oncology children that this avatar will talk them through and say, you're going to have this IV drip put in, but the child can project the avatar on its bed so it doesn't feel alone. the digital space can really make us provide an experience that is so much better. But more importantly, our access can improve. And one of the things we're doing, see, there are so many doctors in so many specialties. We don't always get to talk to each other.
No.
So in the beginning of May, we had a meeting of all the division chiefs at Children's about what we're doing and what we're able to do. And we appointed a point person in each specialty who was going to be the digital point person. So if something changes legally, for example, with the PHE, the public health emergency, or something changes with how we can bill or what we can do for telemedicine, they disseminate that information. We're taking that one step further. At the end of September, the School of Medicine is helping develop a digital health summit. So every specialty in the School of Medicine can come and present how they utilize telehealth, digital medicine, both for the patient, parents, and for the trainers and the providers. And we're going to be able to sort of get some joint up thinking about how we can all collaborate or use other people's ideas to help our own patients. The last thing that's really important is that with all the data we're gathering, we're going to be able to do some really robust research. And if at UPMC everybody's talking to each other and we have this data, the NIH, when they give out grants, is more likely to give grants to places like us than other places which are disparate or disorganized. Mm-hmm. So the Digital Health Summit I see as a real starting point to help people showcase what they're doing and how we can further what's happening to our patients. You know, everybody thought that digital health would reduce inequity and inequality. Well, it hasn't. If you only have a cellular data plan because you can't afford Wi-Fi, the chances of you getting a good quality telemedicine appointment are lower. Mm-hmm. So we need to identify that, and then we need to change the state law to say, hey, basic Wi-Fi for health should be a basic necessity. Mm-hmm. So let's concentrate on putting some money into that, into infrastructure of the digital platform, rather than other things that you might think are important. Let's put that on that space for discussion. So I kind of feel that UPMC Children's is really helping drive this forward, that UPMC as a whole is really interested in developing the digital platform and digital health, but it's not just focused on the one-to-one visit via audio-visual communication. It's interested in the whole thing. And the more automated we make it, the easier it's going to be. So, for example, right now, if I schedule somebody for a surgery, I'm an eye surgeon, when that schedule occurs, Xealth automatically sends the parent the customized information that I want them to know about for the day of the surgery, what the procedure is and what the complications are. So when I meet them, I don't have to go through all of that verbally for 20 or 30 minutes. I can just say, did you read the information we sent you? And if they say yes, I go, okay, were there any questions? Is there anything? And I find that my conversations are much more informed.
Well, it gives parents the time to process, too, before they come in for these big procedures in which you're already stressed about having them.
Exactly.
And it gives you a chance to really process and then ask appropriate questions to their providers.
Exactly. And the other thing that we're getting providers to do is to make videos of what it's like to walk into their clinic and who to expect to see. And we're going to send those out as links. So parents it's just, fear is such a tremendous anxiety producer, and children exhibit anxiety in different ways. Mm-hmm. They won't let you examine them. And so what was booked for a 15-minute appointment drags out, and then everybody else is waiting. But imagine if you can take away some of that anxiety. You can never take away all the fear or all the anxiety, but if you can blunt it, everything starts to work in a different way. And it's like somebody once said, didn't they? They said that until you create what you need, between now and that point, the only thing you have is faith and hope. We have more than faith and hope. We have a tremendous amount of talent and infrastructure here, and we're really hoping to utilize it.
Yeah, it sounds like, when I first was reading about kind of this digital health, I was literally thinking just about the website we have, the My UPMC app that patients use. And it sounds like it is like that, but on steroids and so much better.
And the thing is, it's already here. Everything is there. It's just a question of plugging everybody into the right spots, and then they can get the information they want, including the parents. But, online scheduling, it just does. I mean, how many times do we online book our restaurants, or online book our seats?
For everything.
Right? So why can't we do an online scheduling for an appointment? If the slot is there, it's there. We can go online and we can book it.
And I think it's important, too, that, you mentioned the Digital Health Summit that's going to happen in September. And that's a place where we're going to share ideas so that we're not building it from the ground up, but coming up with working together and how we can make this productive for everyone without reinventing the wheel. That was for providers and, families as well could go to that?
So we are, the first one's going to be for providers.
Wonderful.
Then we're going to do one for nurse practitioners, nurses, APPs, MAs, PAs. But we felt that we would try, because nobody's done this before.
Sure.
In fact, if you look at any other health system, nobody's done a digital health summit for their own staff.
Yeah.
So we thought we would try it out, work out where the problems arose, iron out any kinks, and then do a bigger one for all the other staff who, frankly, are probably more important than the providers. But if we have the providers on board,
sure,
then there'll be someone for them to turn to and say, what is this about? And they go, well, this is how it works. And it'll give you a great opportunity to showcase what you're doing. There are a lot of people who want to create digital applications, apps to help their patients. They just don't know how.
Right.
And so we're going to have people who've done it successfully to show people how to do it and how they can get the help.
Do we have a date or time right now for that summit, or we'll have that information later that we can put with the episode?
But it's the last Friday in September, and it looks like it's going to be at the University Club. And there will always be the very important, and this is very important, hard-working reception in the evening with drinks.
And I assume that information will come through for providers, or there'll be a website that we can attach to this episode when it comes out as well.
Exactly. So what we will be doing is that the call for abstracts will go out. Each chair from each specialty will be told about this and expected to disseminate the information down to all of their providers. And I think there'll be a little bit of healthy competition because people want to show that they're doing more than others. So we're looking forward to a big abstract submission.
Well, I am so excited to learn about all of this growth that we're having at UPMC Children's Hospital of Pittsburgh, and I cannot thank you more for coming to share all of this with us.
Thank you so much. I really appreciate the opportunity.
Appreciate it, and thank you all for listening to That's Pediatrics.
You can find other episodes of That's Pediatrics on Apple Podcasts, Google Podcasts, Spotify, and YouTube. For more information about this podcast or our guests, please visit chp.edu/that'spediatrics. If you've enjoyed this episode, please be sure to rate, review, and subscribe to keep up with our new content. You can also email us at podcast.upmc@gmail.com with any feedback or ideas for topics you'd like our experts to cover on future episodes. Thank you again for listening to That's Pediatrics. Tune in next time.